Welcome to Fatima Today. I'm Carolyn Walsh. Thanks for joining us. Almost 100 years ago, in 1917, Our Lady appeared to three young children, Jacinta, Francisco, and Lucia, in the hills of Fatima, Portugal. She begged them, she implored them, she showed them how to amend their lives for the sins of mankind, and she asked them to be the example for all of mankind to rectify the sins and the offenses made against God. She showed them her sorrowful heart. She let them know that God was sad, that he was angry with all of the terrible things that were happening in the world. And these children, through her love and through her demonstration to them, totally submitted their lives to the will of God. They amended their ways of praying. They amended their ways of living. These are simple, innocent children who knew that they had to rectify their own ways. So we must know that too. And they understood, because Our Lady asked them to understand, that suffering was part of their amendment. It was part of making reparation for their sins so that their salvation could be guaranteed, so that the salvation of all mankind could be guaranteed. She's asking the same thing of us. She's asking us to welcome and even embrace the suffering that God gives to us. As Catholics, we understand that suffering is a means of reparation. We understand it to be a part of our life in many different ways. We can suffer mentally, physically, emotionally, spiritually, financially, numerous ways we could go on and on. One of the hardest ways to suffer, though, is with illness, because it just transforms our lives in ways that we don't want it to, but it does. We oftentimes have to make difficult decisions when it comes to illness, and most of us want to make decisions that are in line with our faith, that are in line with Catholic teaching. So we have brought here today a wonderful guest, Pat Stewart. Thank you, Pat, for joining us.
Thank you for having me.
Pat is going to share with us her book that she's written that is a wonderful guide for us. It's called The Healthcare Decision Guide for Catholics: How to Make Faith-Based Choices for Medical Care and Life-Sustaining Treatment. Pat, this is a book that we didn't know we needed, but now we know we need it. It's a fabulous book. I've been through it, and it looks great. I want to talk to you first before we dive into the book, because we will do that. Our viewers certainly need to hear about what is in here and how it can immediately impact their lives and the choices and decisions that they're making regarding health care. But there's a story behind you writing this book, and I want you to share that with us. But let's let our viewers know how well-credentialed you are, okay? You are an attorney. You've been an attorney for many years. You are a regular practicing Catholic, a lector,
Yes.
an extraordinary minister,
Yes.
director of the rite of initiation at your local parish.
Correct.
And you are also part of our crew at Fatima Today.
I
So
am.
it's such a delight to have watched you evolve with this project and have it come to fruition, and now share it with us and with our viewers. So thank you so much.
Thank you for having me.
There's a great story behind this, because your initial intention to write did not begin with this. So
No, it did not. As you say, my training and experience is as a litigator. I've been an attorney for over 20 years, and most of those years I spent in a practice that was confined to the area of representing victims of airplane accidents. It's called aviation litigation. And I represented people who'd been injured in airplane crashes. And there came a point in time when the practice for me started to change. My partner died, and it stopped being fun for me, and it stopped having the passion that it had had for me years ago. And I started seeking for something else to do. And as I was at that stage of deciding I was going to wind down my practice, I had no idea what I would do next. But I started to pray. And my prayer was, Lord, you've given me talents, you've given me abilities, you've given me training and education and experience. I don't know how you want me to use them. Show me what I'm to do with my life. And I prayed for 5 years for that answer to come. And in 2005, I was introduced through a friend to the producer of this program, Louise Marciano. And it was just at the time when Pope John Paul II and Terri Schiavo were nearing the ends of their lives, and all that issues of life-sustaining treatment and what the church wanted us to do was taking all the headlines in the newspapers. And John Paul II passed away in April, Terri Schiavo in March of 2005. And in May of that year, I was introduced to Luis Marciano, the producer of the program. And in our first meeting, she said to me, you know, as an attorney, you should be drafting faith-based healthcare planning documents. And I had never thought of doing anything remotely like that. But the idea captured my imagination, and I thought, well, that's an interesting idea. Let me see what I can find out about this. And I knew no more about what the church's teachings were at that time than what was in the newspapers. So that summer, I spent doing a lot of research into the church's documents, and by the fall, I had drafted a faith-based healthcare proxy advanced healthcare planning document for use in Massachusetts, which is where I'm licensed to practice. And having gone through this exercise as the fall progressed, I prepared this for a number of clients, and I started thinking, the thought came to me, and I'm sure it was as a result of the Holy Spirit's prompting, that this information should be made available to people who could use it every day and not have to go through the exercise that I had gone through in ferreting out through very dense church documents what was the church's position. And I thought about it and thought about it. And a year ago, in February of 2006, I started writing a little book. And I again had no idea where it was going to go, but I just felt this impetus, this impulse to put it on paper. And I met some wonderful people in the course of the last year who helped facilitate this project, who arranged and helped me acquire the imprimatur of the church for the book, who put me in touch with a printer. And what resulted has just come out recently is my little healthcare decision guide for Catholics.
And it's, you had shared with me earlier that you had begun writing another book, and you had this Sweet Apple Press, which is your publishing company, was all set up and ready to go, but that project just, for some reason, kept facing obstacle after obstacle.
Correct.
And then how the Holy Spirit just providentially came in, and that press was set up for a reason, not for the book you thought it was set up for.
Correct.
But for another one.
Correct.
It's just it's a great story. I think it's interesting to note too that just previous to the death of Terri Schiavo and John Paul II was the death of Lucia, one of the 3 children of Fatima. So that's important for us to know that that's part of the history there too. And to reaffirm that much of the debate that came out at the time of the death of Terri Schiavo and John Paul II was confusing. It was very confusing to us as Catholics. We were saying, wait a minute, what is the teaching? You had some clergy saying one thing, and you had the Pope having certain teachings on hydration and nutrition that were conflicting with what we were reading in the newspaper as far as being Catholic teaching. We can be confident as Catholics that with this guide, this is in fact the Catholic teaching. We don't have to go and do any more research on our own.
That's correct. This book is based on the magisterium of the Catholic Church, and the magisterium is the teaching office of the Church, the only entity which speaks with the authority of Christ as the teacher of the Church in doctrine and in faith. And it is through the teachings of the popes. All of the sources for the little book are listed in the back, should anyone want to do further reading. And they consist of addresses that were given by the popes Pius XII, John Paul II, their writings, the Gospel of Life in the case of John Paul II, the Declaration on Euthanasia, which is authored by the Sacred Congregation for the Doctrine of the Faith. Those are the source documents that I used and from which I have extracted the key principles that the Church wants us to understand and to be guided by when we're confronted with making decisions for health care or life-sustaining treatment. So this is, as I say, it does have the imprimatur of the Church. It is which simply states that there's nothing in here which is contrary to the teachings of the church, so that you can rely on the content as accurate.
Right. One thing I really like about this book, we were speaking earlier about illness and healthcare decisions can be so tremendously emotional, and we can lose sight of what we're to do as Catholics because we respond to what's comfortable or what we desire and all those things. This takes the emotionalism out of it.
Well, hopefully, yes. And I think part of that it can be forgiven because to this point, the church has not done a very good job in helping us learn what we're supposed to do. It hasn't made readily available to us these teachings. As I said, the only place that I've found them was through going through these very weighty documents. Mm-hmm. And so hopefully this little book will help people understand what is the church's position in the first instance, but more to the point, it teaches you how to make the decision. It doesn't just say, here's what you have to decide. It teaches you how, in terms of what are the factors that you need to think about when you're confronting making a decision for health care,
right,
for yourself or someone else.
Let's get into the book and go through it, go through some of the highlights for our viewers. But before we do that, let's put out our disclaimer that neither you nor I are medical experts.
Correct.
So we leave that to the doctors and to the nurses and to the medical caretakers.
Correct. And I'd also say I'm not a theologian. I brought to this exercise my skills acquired through over 20 years as an attorney in reading, deciphering, and understanding very technical documents, complicated documents, but being able to reduce them to an understandable form, simplified, when I'd have to present them to a court or a jury, so people could understand technical materials. So I used that skill in reading through these church documents and put the materials into the book. It's not original writing, not my ideas. I just took the church's ideas and put it in this format.
This is not opinion.
No.
This is absolutely church teaching.
Correct.
So, and it's beautiful, and I will attest that it is absolutely user-friendly. It's like healthcare decision guide for dummies. I mean, it's for Catholics, but it's, I mean, it doesn't take a lot of investment or, oh, I got to think about that on our part. We can clearly understand it, as our viewers will see as we go through it. So let's take a look at it, Pat, if you don't mind.
Sure.
I like the dedication, which is for the greater glory of God and the Roman Catholic Church. So right away, we're offering things up in the right way. Tell me how you formatted it.
I tried to format it as basically a checklist and a workbook so that you could pick it up and after reading a brief introductory paragraph, start just going through it. It's set up with basically 4 major questions in mind for you to consider in making a healthcare decision. And under each question, there are some subparts for you to consider. You can write in the book your answers to each of those subparts when you're trying to put your thoughts together and keep them organized. And having gone through the first 3 questions, depending on what your answers are, there's a conclusion box which will suggest what's the appropriate choice. Should I do this procedure? Do I have to do this procedure? Or may I decline it? And if you're going to do the procedure, there's one more question for you to go through and then come to an appropriate choice in that situation.
So some of the questions that you ask here, if you decide to go forward with a specific treatment, some of the questions you ask are, will it subject the patient to extreme pain? Will it subject the patient to danger? Will it subject the patient to serious risk? Will it impose excessive cost on the patient or the patient's family? Will it impose excessive cost on the patient's community? Those are really important questions to ask.
Those are, and those are the criteria that were established by the Pope, Pius XII, reiterated by John Paul II, and that are in the Catechism of the Catholic Church, another source document which I relied on. So again, these are points that were established by the Church, and I've just extracted them and put them in a format so that people can have them easily before them.
Right. And they can know with confidence that they've made a sound Catholic decision.
Correct. If they follow this little handbook and go through the 4 questions, the first 2 are really, who is the patient and what is the treatment? And there, as I say, are subparts to each of those questions which cause you to think about what are the circumstances of my need to make this decision. Who is the patient? What is the treatment? And having established what those circumstances are, the third question asks, what is the expected result?
Right.
Is there a reasonable prospect that this patient will be improved? And the key word is reasonable, because the Church wants us to consider what is reasonable in the circumstances of every case that's being considered.
And that diffuses the misconception that may be held by some people, that the Church wants you to do absolutely everything for as long as possible in order to keep someone alive. So in other words, the misconception can be that someone in a vegetative state who has no hope for recovery at all, there's no brain activity, they're simply sustained by outside sources, that we should keep them on those support systems for as long as we possibly can.
Correct.
This helps us make decisions and know that we're making decisions properly.
Correct. Because in addition to those first 4 questions in the first chapter, we go on to, there are specific standards that the Church mandates us to follow if certain conditions or issues are present in the case that we're confronting. And they are included in Chapter 2. After you've gone through the exercise of thinking about your particular case, you're asked to look at these 11 other issues that are in Chapter 2, and if any of those are present in your case, that you should be guided by the specific standards of the Church. And those 11 specific issues are when you have an anatomical gift issue, is there a cremation issue, euthanasia, is that a question, imminent and inevitable death, lack of a remedy using ordinary medical care, nutrition and hydration, pain, physician-assisted suicide, pregnancy, quality of life, and vegetative state. If any of those issues are present, then you are asked to be guided by the Church's specific teachings on those points.
And one of the things that is in here too is nutrition and hydration, which was a teaching of John Paul II. He clarified it, and he really hit it home, that patients are to be given nutrition and hydration even through artificial means.
Correct. As long as the patient is obtaining a nutritional benefit,
right,
or pain relief as
right,
the result of administering food and water. That's nutrition and hydration.
But you can't remove the means and support of nutrition and hydration if you deem another person doesn't have the quality of life that you think they should have.
Correct.
That's very important.
Quality of life, which is addressed here, in the typical sense that people hear that term, comes up when someone says, well, Joe Dokes, I know he wouldn't want to live like that. He wouldn't want to live like a vegetable. Let's pull the plug and have done with it. And what the Church teaches is that all life is precious, all life is sacred, and that doesn't change because of a change in a person's physical or intellectual abilities.
That's right. And I know that with Our Lady of Fatima, I came across this, which was really beautiful. In 97, 10 years ago, they celebrated World Day for Sickness in Fatima. And the theme was, in sickness and in health, Jesus Christ gives meaning to life. And we have to remember that at all times, that in illness, Jesus Christ is there. And it's part of our suffering. So we live in a culture, we know we live in a culture that rejects suffering, that thinks suffering is awful and we should avoid it at all costs, even if we're uncomfortable through illness or any type of thing, but we really should embrace it.
Well, that's true, but by the same token, there's another misconception that people have, which is that the Church wants you to suffer endlessly.
Right.
And that's completely wrong. There is adequate provision for pain relief,
Right.
which is addressed in this book. The church teaches, by all means, have pain relief if it's available to you through drugs or medication.
Right.
And while it admires and respects the desires of someone who wants to offer up their suffering to Christ, if you're not able to do that, then by all means have relief of your pain. And when no other options exist, you can continue to receive that pain relief, even if the unintended effect of that is to render you unconscious or to shorten a person's life. So there is a great misconception about what is the standard of the church
Right.
with respect to suffering and what it asks of us as faithful Catholics.
Right. And that's very important to know, because the suffering, there's so much emotional suffering that goes with illness and with that discomfort that we need. Thank you for clarifying that, because that is an important issue. But I think the most important thing in here that strikes me is the nutrition and hydration, because that was such an issue at the time of Terri Schiavo's death.
Correct. And that's, and as recently as 2004, John Paul II came out very unequivocally stating that standard that we alluded to, that the provision of food and water, nutrition and hydration, even if provided through artificial means, is ordinary care. It is basic life care, and it's not a medical procedure. Therefore, it should not be withdrawn, and as long as it's providing a nutritive benefit to the patient.
And Pat, we come to the towards the end of the book, and you have a 4-step plan here, which is very clear. Can you talk us through that?
Sure. The third little chapter in this book is called Planning for the Future, and in it I propose a 4-step plan so that you can ensure that medical decisions made for you in the future, should you be unable to make your own decisions or become incapacitated, are made according to the church's standards. And the 4 steps are share, select, sign, and send. The first step, share, is to share your beliefs with your family, with your healthcare providers, people who may be involved with your health care in the future, so they understand how you want decisions to be made for you in keeping with the church's teaching. And you can use chapter 1 and 2 as a guide, because it's all contained right there. Select someone to represent you, to be your healthcare representative if events should occur that you're unable to make or communicate your healthcare decisions for yourself. Now, this isn't just, we're talking about people who are in a near-death condition. This is for anything that might occur to you medically. Might be a temporary condition where you just can't speak for yourself.
Right.
You're rendered unconscious temporarily.
Right.
You want someone to be able to speak for you.
So any surgical procedure, I imagine, has you sign that. I know certainly when having children, you always sign for a healthcare proxy.
Well, that's become very common now in hospitals. But be aware that the healthcare proxies that are provided by hospitals are secular.
Right.
They conform to the statutory requirements of the state in which you reside,
Right.
which is fine, except they are not faith-based, largely because people don't know what to put in there
Right.
to make them faith-based. So what is also available through this little book or through my website is a statement that you can attach to a secular document to make it faith-based, and you'll be good to go if you just put the two together.
So we have share, select.
The third step is sign. Sign your advanced healthcare planning documents, and the last is send. Send copies to your physician, to your hospital,
Okay.
and to people who need to know what,
That's
your choices are.
That's good to know. And then finally, send. Send is the final. I'm jumping back. So really, the time to do this is not when you're ill, when you suddenly fall ill. These are decisions that we all need to be making now. And this book, The Healthcare Decision Guide for Catholics, How to Make Faith-Based Choices for Medical Care and Life-Sustaining Treatment, and your healthcare, the Catholic Statement of Beliefs and Decision-Making Standards for Medical Care and Life-Sustaining Treatment, are available through your Sweet Apple Press.
That's correct. The address is Sweet Apple Press, P.O. Box 770, Norwell, Massachusetts 02061, or on the web at sweetapplepress.com.
These books, I think they're great gifts. They really are. The book is $7, and the attachment to Healthcare Proxy is how much? $10?
10.
So well worth anybody's effort to put everything together. Pat, thank you so much for joining us and for doing this work. It's a pleasure to have you and have you go through this. And I encourage everybody to take a look at this. And I also encourage everybody to remember, as Our Lady of Fatima implored us, to say your rosary, say it every day. Begin with one Hail Mary if you don't say it yet, and you will grow to love it, and your devotion will lead you to saying the rosary every day. And wear your scapular so that you're protected. Thank you for joining us. See you again next week at the same time.
Our Lady of Fatima said, "I have come to ask the faithful to amend their lives and ask pardon for their sins. They must cease offending God, who is already too much offended." Our Lady at Fatima said, "Pray, pray a great deal, and make sacrifices for sinners, for many souls go to hell because they have no one to pray and make sacrifices for them.